So welcome to tonight's webinar on sleep and brain health with Associate Professor Matthew Pase. Just a few bits of generic housekeeping up front. To get the most out of this session, we just want to make sure that you have as good of an internet connection as possible. So check that you don't have a video playing on a device in another room or in another tab. Next, we've got these Zoom reactions. You'll see these in the lower toolbar on Zoom, so please use them. It's great to see what you're loving throughout the presentation when you're learning something new. And next up, oh, great, I can see that some people have already found them. Thank you. And next up is the Q&A function, and this will be super important for the back half of the presentation with the Q&A, because this is where you'll submit questions for tonight's speaker. So submit your questions in the Q&A function rather than in the chat, and keep an eye on the questions submitted by other people, and you can upvote or like with this thumbs up symbol the questions that you'd like to see answered. At the end of the presentation, we'll prioritize those with the most upvotes. So for those of you who are tuning into your first webinar for the week today, or who don't know much about the Brain Foundation, I'd like to talk about what we do. I've run through this for the past 2 days as well, so I'll keep things quick, but our primary goal is to fund research into brain diseases, disorders, and injuries. And we also provide informative resources about different brain disorders, and we raise awareness and advocate for the patient community. Now, if you're here, you will have seen our emails throughout this week, and we do send out newsletters every month or two with updates about our work and general brain research news. However, if you found the webinars this week informative and you'd like to see more regular updates, you can find us on social media as well. We post a lot of great content here, including weekly brain teasers, a monthly neuro news update, highlighting interesting research, and other information about brain disorders and awareness events. So we'd love for you to join the community, and if you're interested, you can follow us at the accounts shown on the slides. So tonight's webinar is for anyone who is interested in improving their brain health. If you want to understand more about common brain diseases, disorders, and injuries, and if you'd like to ask a question with our expert. And tonight's expert speaker is Associate Professor Matthew Pase. Matthew Pase is an Associate Professor at Monash University, and he leads the Epidemiology of Dementia Lab, the Aging and Neurodegeneration Research Program at the School of Psychological Science, and the Aging Well Pillar at the Turner Institute. His current research aims to make dementia preventable for future generations, and by advancing our understanding of risk factors and early biomarkers. He is also one of our 2024 Brain Foundation Research Grant recipients, and he was awarded a grant for research into the relationship between sleep, brain waste clearance, and dementia risk. Dr. Pase also leads several local and global initiatives, including the Brain and Cognitive Health Cohort, and he is the co-principal investigator of the NIH-funded Sleep and Dementia Consortium in the US. And just a quick intro about me. My name is Anik, and I'll be hosting tonight's webinar. I manage the grants application process here at the Brain Foundation and also write a lot of the content on our website and newsletters. And we also have Carl Cincinnato here tonight, who leads our division Migraine and Headache Australia. He will be moderating today's webinar, and you'll see him in the webinar chat box as Carl Cincinnato brackets moderator. So if you have any questions or issues today, just ask in the chat and Carl should be able to help. Without any further ado, I will let Dr. Pase start the presentation.
Hi everyone, it's my pleasure to talk to you today about sleep and brain health. So in this presentation, I'm going to give you a bit of background about dementia and what it is and why sleep might be important. And then I'm going to discuss the evidence around sleep dementia associations and possible mechanisms. And then I'm going to break sleep down into its different components, including its duration, its quality, timing and regularity, and how each of these components might be important for brain health. So at Monash University, I lead the Epidemiology of Dementia Lab, and our aim is really to make dementia preventable for future generations. And we do this by looking at large cohort studies and clinical studies, trying to come up with evidence to characterize different risk and protective factors. And one factor that we've been interested in lately is the role of poor sleep. Just a bit of background on dementia. When I speak to the general public, I often hear a little bit of confusion about what is dementia, how is it different from Alzheimer's disease. So dementia is an umbrella term that describes a collection of symptoms that affect the brain, and this includes a progressive decline in thinking and behavior and memory. And dementia is severe enough to impact an individual's ability to live their daily life. So some level of forgetfulness is expected with aging, but in dementia, it really does impact someone's day-to-day functioning. Now, dementia can be due to any number of different conditions, and Alzheimer's disease is the most common, but it's by no means the only one. There are other kinds of dementias too. Vascular dementias are common. Dementia can be due to other proteins in the brain, for example, Lewy body dementia, frontotemporal dementias. Dementia can also be due to Parkinson's disease or different viruses. And one note is that in life, it's very common for a person to get a diagnosis of one disease contributing to dementia. So, for example, often people know of someone who has dementia due to Alzheimer's disease. But when we look in the brains of people who have died with dementia, we often see that they have multiple contributing pathologies in their brain. So, for example, Alzheimer's disease and something else. And this has implications for treatment because if there are many things contributing to dementia, it suggests that treatments or preventative strategies need to tackle multiple different pathways. And so my research is very interested in thinking about dementia much like we think about heart disease. So characterizing its different risk factors and then working out, well, what can we actually do in our lives to prevent, to lower our risk of getting dementia in late life. Now, here is a collection of different modifiable risk factors that researchers generally agree on that are important for dementia prevention. And this was summarized in what's called the Lancet Commission, which suggested 14 risk factors which account for about 45% of all dementia cases. I won't go through all of these, but a lot of these you'll notice are associated with other chronic conditions of aging. So, for example, hypertension or high blood pressure, smoking and obesity. These are all risk factors for heart disease, as well as dementia. But one interesting thing was that this Lancet Commission that summarized the evidence for different risk factors discussed sleep, but didn't make solid recommendations around sleep being a modifiable dementia risk factor. And today in this talk, I'd like to show you the evidence for sleep being important for brain health. And there are many mechanisms to suggest that sleep is important. Sleep is really important for memory consolidation. So we actually remember information better after a good night's sleep. And this has been shown scientifically very robustly. So for example, if you give someone something to remember and then you let them sleep normally as compared to waking them up during the night, they do remember that information a lot better the next day. Sleep's also important for maintaining brain connections or synaptic function. Good sleep's also important for maintaining the vascular health of the brain. And I'll talk about in a second the role of sleep in clearing out amyloid. Now, amyloid is one of two proteins that accumulates to cause Alzheimer's disease, the other being tau. And good sleep is also important for immune function. So lots of mechanisms to show that sleep is important for an aging brain. If you look on the left here, you'll see this diagram. It looks a bit complicated, but I'll walk you through it. This is essentially showing something that we call glymphatic clearance, and that is, this is how the brain clears itself of brain waste. So if you look at this red, this is the artery, and to the right of that, the blue thing is a vein. And in between that, you've got all the cells in the brain, such as neurons. And as these neurons are firing, just as a consequence of you thinking, you get this buildup of metabolic waste, including amyloid. Now, what happens is fluid travels along these arteries and enters the brain through these channels called aquaporin 4 channels. And the fluid flows through the brain, exits along the vein, and then drains. And it's essentially like washing the dishes or washing your hands. The fluid flowing through the brain clears the brain of metabolic waste. And this process was shown to be much more effective when someone's sleeping. And scientists have thus suggested that one function of sleep is to be like a garbage truck and clear the brain of metabolic waste that accumulates during the day. To the right of that, you've got data showing amyloid beta levels, amyloid being that protein that accumulates in Alzheimer's disease. And this is looking at amyloid in the interstitial fluid, which is that space in the brain shown here between the vein and the artery. And you can see that amyloid levels follow this very predictable light-dark cycle. And this is taken from a mouse. And so mice are awake when it's dark because they're nocturnal, and then they're asleep during the day when it's light. And so you can see that when the mice are awake, their amyloid levels are very high. Then when they go to sleep, their amyloid levels become lower. Then when they wake up again, they increase, and this cycle continues, suggesting that sleep is really important for amyloid dynamics and amyloid clearance, suggesting it may have a role in Alzheimer's disease prevention. Now I'm going to talk about the different components of sleep, and then I'll talk about how they might be important for brain health. Sleep on its most basic level can be thought of in terms of its duration. So it's generally recommended that individuals get, or older adults get, between 7 to 9 hours of sleep per night. And as we age, our sleep needs change quite significantly. So newborns, for example, or infants require large amounts of sleep, and this gradually changes as we mature. And in old age, adults tend to sleep even less than, say, when they're in midlife. And it's unclear whether this represents a changing sleep need or whether this is something that sort of just changes as we get older, but that's not that advantageous. We can also break sleep duration down into different stages. So, for example, when we first go to sleep, we enter a very light stage of sleep called stage 1. And this is very much a transition into sleep. Our sleep then gets progressively deeper with stage 2. And then stage 3, our sleep becomes quite deep. And this is where our sleep is thought to be very restorative. It's also called slow wave sleep or deep sleep. And if you're woken up during this stage, you'll feel very groggy. And then stage 4 is REM sleep, where our eyes move rapidly from side to side. And it's that stage of sleep that's commonly associated with dreaming. And if you're woken up in REM sleep, you'll typically be able to remember your dreams, even if just for a brief period of time. We can also think about sleep in terms of its timing and its regularity. So because we live on Earth, we live in these very predictable 24-hour light-dark cycles. And our sleep cycles are tied to these light-dark cycles. And when our sleep schedule becomes out of sync with our environment, that can lead to bad health outcomes. For example, shift workers are constantly fighting this battle between their internal body clock and the external light-dark signals. And being a shift worker is actually associated with a higher risk of several chronic health conditions. Even when we see a daylight saving shift, so when we shift our clocks forward or backwards by 1 hour, we see spikes in hospital admissions for things like heart attacks, such as the power of sleep timing and regularity. And then there are also sleep disorders as well, which tend to be underdiagnosed, but common ones include insomnia, sleep apnea, restless leg syndrome, and I'll talk about this a bit more later on. So there are several mechanisms to suggest that sleep is important or potentially important for dementia. But we know that dementia also impacts sleep. And so it's very hard to work out chicken or egg, in other words, what comes first. So sleep is a consequence of, or is generated by regions within our brain. And if these become damaged in dementia, then it's possible that dementia could lead to people having poor sleep. Similarly, if you have Alzheimer's disease, for example, or other pathologies accumulating in sleep-wake regions of the brain, sleep could become disrupted. Dementia is also associated with chemical changes in the brain known as neurotransmitters. This could impact sleep. It's very common to have comorbidities in dementia, other health conditions or pain, for example, which could affect sleep. Other conditions like depression, anxiety, or apathy can impact sleep. As well as other things like changes in social pursuits, which might affect sleep timing or regularity. And if you imagine someone in a nursing home, they don't necessarily have control over light or sound, which could impact their sleep as well. And if you look at this table, this is data from a study that I wasn't involved with, but they essentially compared the sleep quality of patients with dementia to people who didn't have dementia and showed that aspects of sleep quality were vastly different. So, for example, percentage of REM sleep, and if you look at the very right, you can see that on average, controls or people without dementia spend 15% of their night in REM sleep. In contrast, people with mild Alzheimer's disease spend only 6% of the night in REM sleep, and those with moderate to severe Alzheimer's disease spend about 4% of their night in REM sleep. So quite large and profound differences in sleep between dementia patients and non-patients. But of course, that chicken and egg is really hard to work out in terms of what comes first, but it's perhaps a combination of both. So now I'm going to talk about those different sleep components and how they relate to brain health. We did some research earlier on looking at relationships between sleep duration and risk of dementia. At the time we did this study, it was thought that both short sleep duration and long sleep duration were bad for the brain. And what was unique about our study was that we looked at people's sleep duration multiple points in their life and then followed them up to see who got dementia and who didn't. What we found was that those participants who were reporting sleeping more than 9 hours a night, so those that had long sleep duration, they had twice the risk of going on to develop dementia. However, when we look back in people's lives at their sleep habits earlier in life, we found that if these people were always long sleepers, they didn't have a high risk of going on to get dementia. In other words, if being a long sleeper was your normal and it's something that you had always done, it didn't appear that your risk of dementia was increased. However, if one point in your life you were a normal sleeper and then all of a sudden transitioned to being a long sleeper in late life, this was associated with a 2.5 increase in developing dementia. And if you combine that with having problems with thinking and memory, dementia risk was about 6 times higher. And from this, we sort of suggested that long sleep duration wasn't a risk factor for dementia itself, but perhaps in some people where they see a big change or a quick change in their sleep drive, and they also have thinking and memory problems, this might be a sign of something potentially going wrong and may warrant follow-up with the doctor. In our study, we didn't see any relationship between short sleep duration and dementia risk, although those with short sleep did show poorer thinking and memory, but that's probably just because they were tired in the days of testing. We've also done other research to look at this as well. This is work by a PhD student of mine called Maddie Gibson. And what you're looking at here is levels of amyloid beta, again, that protein that accumulates in Alzheimer's disease. And this time measured in the cerebral spinal fluid, which is a fluid that bathes the brain. And it provides a direct window into what's happening in the brain. And here you're just looking at levels of amyloid beta between short sleepers and normal sleepers. Now, amyloid's quite interesting because when you measure it in fluid, like cerebrospinal fluid, low levels are actually worse. And the thinking is that as amyloid accumulates in the brain, there's less and less that you're able to measure in blood or in cerebrospinal fluid because it's being taken up in the brain, less is coming into the fluid. And so here we see that in short sleepers have lower or worse levels of amyloid as compared to normal sleepers. We've also extended this work to look at sleep quality. And so this is probably the largest study to look at sleep quality using gold standard techniques called a PSG or polysomnography, which is an overnight sleep study, and look at how sleep quality relates to cognitive health. And here we combine data, or we pulled together data from lots of different studies that had overnight sleep data conducted in the same way, and data was all analyzed centrally in the same place. This graph here looks at the relationships between sleep quality and brain health, so cognition measured within the next 5 years. Now, this is called a forest plot, and it combines together estimates from different studies combined. The top result is for something called sleep maintenance efficiency, and this is essentially how efficient is your sleep. In other words, when you spend time in bed, what percentage of that time is spent asleep? And someone with higher sleep quality will have higher sleep efficiency. We see that across studies, participants with higher sleep quality or higher sleep maintenance efficiency have better cognition within the next 5 years. The result below that is called WASO, or wake after sleep onset, and it looks at once someone goes to sleep, how long are they spending awake after they fall asleep? So, for example, someone with high WASO will wake up a lot during the night and have difficulty falling back asleep. And we find that participants with higher amounts of WASO have worse cognitive performance. In this study, we didn't find any relationship between total sleep time and cognition. So the take home here was that participants with poorer sleep quality displayed poorer thinking and memory skills 5 years later. We've also followed this up to look at different sleep stages. So this is work led by a former postdoc of mine, Dr. Andriane Boril, who now has her own lab in Canada. And here we looked at almost 500 participants who had an overnight sleep study, and they also had a brain MRI scan. And we found that those participants that spent more time in slow wave sleep had a healthier looking brain, and that was characterized by having a bigger brain, as well as better integrity of the white matter, which is responsible for connecting different areas of the brain and sharing information. And so in this study, we weren't able to determine whether more slow wave sleep caused a healthier brain or whether a healthier brain caused more slow wave sleep, but we have been following this up since. So for example, in this study here, we performed 2 overnight sleep studies about 5 years apart, which enabled us to characterize how different sleep stages changed with time and how this related to risk of dementia. And what we found was that as people got older, their slow wave sleep generally declined with time. And here, if you look on the left, you're looking at changes in each sleep stage. So stage 1, stage 2, slow wave sleep, and REM. And the 2 different colors are people who eventually did go on to develop dementia, shown in gray, and those people who remain dementia-free, shown in black. And if you look here for slow wave sleep, you can see that those patients who went on, or those participants, I should say, who went on to develop dementia showed a greater decline in slow wave sleep over time as compared to those people who remained dementia-free. And this is also illustrated in this middle figure, but shown slightly differently. So here, each line represents one person's change in slow wave sleep over time. And everyone on the bottom is someone who developed dementia, and everyone on the top is someone who remained dementia-free. And those that are red, or that red color coding, is simply to show you those people that declined. And you can see that of the dementia cases, most people did experience a decline in slow wave sleep. And in fact, when we crunch the numbers, we find that just a 1% reduction in slow wave sleep per year associates with about a 27% increase in dementia risk. But it's not just slow wave sleep that's important. Other sleep stages are important too. In this study, we looked at REM sleep and found that just a 1% reduction in REM sleep was associated with a 9% increase in dementia risk. And interestingly, taking longer to get into REM sleep also was associated with the higher risk of getting dementia. And these studies were recently sort of confirmed just a few weeks ago by a large study in China that showed very similar findings looking at brain health, whereby also taking longer to get into REM sleep during the night was associated with having poorer brain health. Okay, now I'm going to talk a little bit about sleep regularity. This has been very understudied in the dementia space. So sleep timing and regularity are an important dimension of sleep health. As I mentioned before, night shift poses challenges to sleep regularity, and it's actually classified as a probable carcinogen because it's associated with a higher risk of developing cancer. Persons with irregular sleep might experience a mismatch between their sleep schedules and the light-dark cycle, and this has been associated with poorer cardiometabolic health, so poorer heart health, for example. And we know that poor heart health, things like high blood pressure, diabetes, etc., are associated with the higher risk of getting dementia. And so we were interested to explore what is the direct relationship between irregular sleep patterns and risk of dementia. And this work was led by Dr. Steph Uloro, who's a research fellow in my team, and Lockie Cribb, who's a PhD student within my team. So for this study, we used UK Biobank data to investigate the associations between sleep regularity and risk of incident dementia. We looked at people aged 40 to 69 years of age, and we measured sleep regularity using this wrist-worn device shown here. And this device allows us to calculate an individual's sleep regularity using something called the Sleep Regularity Index, which looks at how regular someone's sleep is day to day. We calculate this on a scale from 0 to 100, where 100 is perfectly regular and 0 is completely random. And then participants were followed up for about 7 years to see who developed dementia. On the left here, you can see the main results. The average sleep regularity index score was about 60 out of 100. And from this graph, you can see that those participants with sleep regularity scores below the population average, so below 60, had a higher risk of going on to get dementia, such that those participants with the lowest sleep regularity had about a 1.7 increase in their risk of developing dementia, so about a 75% increase in risk. Interestingly, it looks like there's a slight uptick here whereby those with very high sleep regularity have a slightly higher increase in their risk of dementia. However, this wasn't statistically confirmed. There's a lot of error in that signal. So essentially, those with very high regularity have a similar risk of dementia to those with average sleep regularity, but those with very low sleep regularity have a higher risk of going on to get dementia in this study. We also looked at brain MRI outcomes, so for example, brain volume on MRI, and this provided very similar findings to support the dementia study results. So for example, if we just look here at the top one, the top left looks at total brain volume, again on the x-axis along the bottom. You've got average SRI scores, sleep regularity index scores. Again, the average score is about 60. And you can see those with the average score of about 60 have the largest, the highest brain volumes. And those with the lowest sleep regularity scores of around 40 have the lowest brain volumes. We've also done a little bit of research looking at different sleep disorders. This was a study, again, led by Andre and Bril. And here we had about 500 participants from the community who self-reported symptoms of insomnia. Now, insomnia is one of the most common sleep disorders, and it's characterized by difficulty falling asleep, trouble staying asleep once you go to sleep, or waking up too early. And we see that those participants who endorse more symptoms of insomnia have poorer thinking and memory when we assess them around 3 years later, particularly poorer memory. And this effect was more prominent in ApoE4 carriers, and this is a gene which is associated with risk of getting dementia in old age. We also looked at sleep apnea, which is associated with trouble breathing during sleep, so your airways temporarily close and deprive your brain potentially of oxygen. And we found that in this study, again, this is that same study I mentioned before, where we had about 6,000 overnight sleep studies. We then looked at people's thinking and memory within the next 5 years. And we found that having mild to severe obstructive sleep apnea was associated with having poorer cognitive function. And similarly, having moderate to severe obstructive sleep apnea was associated with having poorer cognition. Now, these were just people living in the community. They had a sleep study done as part of a research study. They didn't present to a sleep clinic. They didn't present to a memory clinic. So these findings were quite interesting because most people in the study who had sleep apnea didn't know that they had it. And it suggests that maybe mild sleep apnea is not necessarily benign, but may be associated with cognitive function. And so that leads to one question. So sleep apnea is treatable. What happens if you try and treat it? What happens to people's brain health? Unfortunately, conducting studies in this area is very challenging because people's thinking and memory as they age tends to change very, very slowly. And it means you need long studies with very substantial follow-ups to start to tease out these effects. And conducting a clinical trial for such a long period of time is very difficult because to compare a treatment, you have to have a control group, and potentially withholding treatments can be unethical. This is a study done by Catherine Franks, who's now finished her PhD, but she was a PhD student of mine at the time. And she did a systematic review and meta-analysis to look at all the studies that were out there that had treated sleep apnea and then looked at the effects of that on thinking and memory. Now, most studies, as I was alluding to before, were very short in duration, so around 3 months. So they really only looked at short-term cognitive effects. So we really don't have any long-term cognitive data. But essentially what she found was that if this graph here shown on the left shows that these studies that had treatment for sleep apnea tended to improve people's daytime function. So those people who were getting treatment did have better daytime function. However, for example, less sleepiness. However, this did not translate to any improvements in cognition. In other words, treating sleep apnea didn't improve thinking or memory skills after 3 months relative to no treatment. However, as mentioned, these studies were very short in duration, and there weren't that many of them either. So there's more research needed here. So one question that you might have following all this is, well, what do I do about this? How do I go about improving my sleep? I think the first thing to mention is that many sleep disorders are treatable. So if you're having specific difficulties with your sleep, it's worth talking to your doctor about potential assessments and therapies. But beyond that, more general advice is to make sleep a priority. Many people see it as a badge of honor to get by without getting much sleep, but actually, it's important to make sleep a priority and to realize its importance. Much like you would make time to do physical activity because you know physical activity is important, knowing that sleep's important means that it's important to put aside time to get good sleep. There are also things that we can do to improve what's called our sleep hygiene. And this includes making sleep regular, so trying to set regular sleep-wake schedules, keeping naps short and trying to nap before late afternoon, so early afternoon or before. If you nap too close to bedtime, it can take away what's called your sleep pressure and make it hard for you to fall asleep at night. Exercising during the day can improve the quality of our sleep. Also maximizing our bedroom for sleep. So for example, making sure that our bedroom is a comfortable temperature, for example, not too hot and quite dark and quiet are all important. It's also important to maintain your bedroom or your bed as a sort of comfortable space that you associate with sleep, not a place that you associate with work activities, for example. So it's not a good habit to sit on your bed with your laptop doing work because then it might, when you go to sleep at night, bring back memories of work and trigger your thoughts around things that you need to do, which might create anxiety. Following a regular routine and sticking to it can also help. And limiting light and stimulants proximal to bedtime can also help. So light is the primary reset for our body clock, and getting bright light in the morning is good because it helps reset our body clock to the light-dark cycle. But getting lots of bright light close to our bedtime can push our body clock back and make it harder to fall asleep. If you want more tips, visit the sleepfoundation.org for a really good summary of different things that you can do. Okay, so next steps, we're very interested in working out who is most vulnerable to the effects of poor sleep. And we're going to be looking at sleep and gene interactions with the help of the Brain Foundation and some funding that they've given us. So I mentioned earlier on that there's this mechanism called lymphatic clearance. It's really crucial for the clearance of amyloid and other proteins in the brain. And this appears to be dependent not only on sleep, but these channels called aquaporin 4 water channels. And so we're looking at whether differences whether genetic differences in aquaporin 4 are associated with how well this process works and whether that's important for dementia. We're also very interested in evaluating specific interventions. So for example, because each day is only 24 hours long, people need to make choices about what they're going to prioritize. So for example, is it worth sleeping in an extra hour to get more sleep? If that comes at the expense of perhaps going for a walk to do some exercise. And so we're going to be looking at the effects of doing these different kinds of interventions. So to summarize, sleep of sufficient duration and quality is essential for a healthy brain. Relationships between sleep and dementia might be bidirectional, meaning that there's evidence to suggest that good sleep might preserve brain health, but then also dementia might cause poor sleep. Many sleep disorders are treatable, and there are many things we can do to improve our sleep. And it all starts with realizing the importance of sleep and making it a priority. So with that, I wanted to thank the Brain Foundation for their generous support, as well as our other funding, and as well as my wonderful team for which this work would not be possible. Thank you for your attention.
Thank you so much, Dr. Pase, for a fantastic presentation. Just a heads up, anyone who had trouble reading the slides, I know it can be tricky with especially some of those smaller graphs. There is a PDF of the slides being sent out via email right after the presentation ends, so you'll all have that soon. Let's get started with the Q&A. We've got lots of great questions coming through. The top one here is from Kylie. I know you covered this a bit in your presentation, but she was wondering if there are any other suggestions to assist with helping to regain sleep apart from melatonin. I also saw a question from Eva as well, asking about improving sleep and medicating with Restovit or melatonin. I know you talked about behavioral things, but how does medication possibly fit into that?
Yeah, thanks for the questions. So melatonin can play a role. It's important to realize that its timing is also crucial. So it's not just a matter of taking it, but it's important to take it at the right time. And so there should be information on this on the Sleep Foundation website, but off the top of my head, taking it a few hours before bedtime is generally advised so that it has time to work. Not just taking it immediately before you go to bed. I'm not a sleep physician, so I don't treat patients. But my understanding is that sleep medications, like pharmaceutical medications, can play a role, but perhaps not advised to become addicted to them or use them long term. But they can certainly help people through patches of having bad sleep. Behaviorally, there are also things that people can do. So I mentioned that light is a primary driver of sleep, and so getting light at the right time is really crucial. Avoiding bright light at night. And I talked about some tips at the end that can help. So those are things that we call sort of sleep hygiene. So they're more general recommendations that people can do to make sure they're doing all the right things that it can promote good sleep. But of course, everyone has different circumstances, different underlying conditions and things going on. And so it is worth, if you're having trouble getting sleep, getting good sleep, speaking with your doctor, and if you're not satisfied, potentially getting a follow-up with the sleep physician to have a more tailored plan that's specific to you. And I hope you can hear me okay. A thunderstorm just started where I am, so apologies if there are any audio difficulties.
I can hear you fine on my end, so I hope hopefully everyone else can as well. That's really interesting to hear about the melatonin timing. I think I have taken it before in the past, right before bed, and then wondered why it didn't work. So that's good to know the answer there.
Yeah, and
Um,
it's not just, sorry to interrupt, but it's not also, I've been to America a lot and they have very high doses of melatonin that you can sort of buy. And, high dose is not necessarily better. In Australia, I think the doses tend to be lower. So it is really about the timing and not just, taking as much of it as you can.
Okay, that's good to know. Thank you. The next question is from Ellen, and she asks if nana naps or a quick afternoon nap would assist in better brain health.
Yeah, we don't have really any evidence about what a nap can do for brain health specifically. But if you are feeling tired, it is okay to have a nap during the day to sort of overcome that sleep pressure and mean that you can function to a higher standard during the day and get the most out of your day. It's generally good to keep naps somewhat short and not too late in the afternoon. If you're sort of sleeping for long periods during the day or sleeping too close to your normal bedtime, it can mean that you don't sleep as well during the night because you're having too much nap time during the day, basically. But naps can be okay, but we don't really have evidence around what they mean for brain health specifically.
Okay. I guess kind of that um, general advice of if it makes you feel better, then and it's not harming you negatively, then I guess it can be a help.
Yeah, and maybe just to add, if you are feeling like you're going to bed and spending enough time asleep at night, but then you're still feeling tired during the day and you're feeling the need to nap, that might be a signal that it's worth sort of going to have a chat with your doctor because maybe there are some things that are actually disturbing your sleep at night that you're not aware of that potentially could be treated.
Okay, great. Thank you. The next question is from an anonymous attendee, and they've asked if you've looked at the connection between epilepsy, cognitive difficulties, or menopause and poor sleep slash wakefulness during the night. Sorry, and like, what did you find? I guess, yeah, all of those different elements: epilepsy, cognition, menopause, and sleep regularity, I guess. Yeah.
Yeah, good questions. I don't have any experience or expertise in epilepsy, but we are actually working on a grant at the moment to try and study better the relationships between menopause and dementia and how sleep might play, or menopause and cognition, I should say, and how sleep might feed into the mix. So it's quite common to experience brain fog, for example, with menopause. And we're trying to untangle whether sleep and sleep-related processes might be important there. There really isn't a lot of evidence, but or a lot of research on the subject, I should say, but it is a really important subject. And we are trying to study this in more detail. We do know that women, for example, have a higher risk of going on to get dementia. And it's not just due to the fact that women tend to live longer than men. There seem to be other factors involved as well. The difference between men and women, it's not astronomical, but it is there. And so we do think that it's really important to try and untangle this and work out why. Yeah.
Yeah, of course. Yeah, well, I guess we look forward to hearing more about how that research goes. The next question, also from an anonymous attendee, is asking if Apple Watches, or I guess any other kind of wearable device, if they're a good indicator for sleep patterns.
Good question. It will vary on the specific device used. We use medical grade devices that I guess operate similar to like an Apple Watch or a Fitbit to track sleep-wake patterns. They can do some things better than others. So, for example, they might be able to sort of reliably determine, or to some degree, determine when you're going to bed and when you're waking up, and you can kind of look at changes over a few months or sort of how it changes over time. But they generally are not very good at differentiating more detailed information like how much time you're getting in REM sleep or slow wave sleep. I've seen some devices sort of spit out information on this, but there really isn't a lot of evidence to suggest that they're doing that well. But in terms of the more basic parameters of how much time you're spending in bed, potentially how many times are you waking up during the night, they might be able to provide some information on that. So if you're finding it kind of interesting and useful to track your sleep, you can do that, but they certainly don't replace a sort of full medical grade examination of your sleep.
Mhm. Okay, great. Thank you. The next question is from Chris, and Chris has asked, how are children and teenagers' brains affected by lack of sleep? Can poor sleeping lead to poor brain health as children age?
That's a great question. Again, we don't have a lot of information on sort of what habits or how habits early in life, so for example, in the teenage years, will impact your brain as you get older. We know that midlife, I know this isn't sort of what you asked, but we know that midlife is a critical period for how your brain ages into late life. And so we know that, for example, your vascular health in midlife is critically important for what your brain looks like when you're 70, 80, and 90. What you do in your teenage years, we're less sure about. Sleep is certainly important in that age group, and it relates to things like mood and obviously academic performance and other important metrics. So certainly getting sleep or good sleep is strongly tied to having healthy brain outcomes. What it means for sort of long-term outcomes into late life, we don't simply have that evidence. Obviously, it would require sort of very large, long studies to follow up these people over time. I agree it would be really interesting to sort of further untangle that if we could sort of suggest that what people do in their 20s and 30s is important for their brain health. It would sort of be, I guess, maybe more powerful for motivating people to make positive changes earlier in life.
Yeah, no, definitely. Always good to encourage those healthy behaviors, healthy habits earlier on. And the next question, also from an anonymous attendee, is asking, what about ADHD? Does that increase risk of dementia? And no, this might not be your specialty, but do you have any thoughts on it?
Yeah, again, not my specialty. I don't have, I'm not aware of any links. So I don't think there is one, but I'm not an expert on the subject. But to my evidence, there's no real links between, to my knowledge, sorry, there is no real links between ADHD and dementia, but not something that I've looked at specifically.
Okay. Thank you. The next question from Chris is it too late if I've had terrible sleep for the last decade, and my husband had Lewy body dementia with really bad sleep? At 66, is it too late to change those patterns?
No, definitely not. 66, you're still sort of young in your midlife, so plenty of time to make positive changes. I don't think it's ever too late to make positive changes for the purpose of sort of maintaining your brain health. So no, I would say have at it. We know that for example, Lewy bodies and Parkinson's disease can actually lead to changes in sleep. And so it sounds like you've had some personal experience there and noticed that, which is sad for you. But I would say that it's still there's still time for you to make positive changes for your sleep. Sleep is very malleable. You can change it tomorrow if you want to. So go for it.
Okay, great. Um, That's fantastic. It reminds me of Dr. Samtani on Monday night. He was talking about how, even if you have early stages of dementia or mild cognitive impairment, it's still not too late to try and do things to try and improve your brain health. So some positive messages coming out on all fronts. The next question is from Murdula. And they've asked, we do night shifts for 4 days and then 4 day shifts. Please guide on how we might be able to take care of our sleep cycle and brain health.
Yeah, great question. It's complex, I guess, and I don't work with shift workers directly, but I have colleagues that, for example, specialize in the treatment of sleep and do work with shift workers such as yourself. So if you're having trouble dealing with the schedule and the scheduling shifts, there is help available. For example, Monash has a healthy sleep clinic, and there are psychologists that you can work with to sort of come up with strategies that work for you. Generally speaking, shift work is quite challenging to adapt to, and the most challenging is when you have kind of one night on, one night off, one night on, one night off. So it is advantageous to work in chunks. So for example, 4 days on, 4 days off, which it sounds like you're doing. So that's one positive thing. If you're finding it hard to adjust from those 4 days on off, things like light therapy or timing light appropriately and maybe using melatonin as well can be beneficial, but it's important to work with someone who sort of can understand how they can be used to sort of tailor your specific sleep schedule to the difficulties that you're having. So there is some help available. Some people tend to be able to sort of snap out of those 4 days and get back to the normal routine quite easily. And then some people tend to have a more laggy circadian rhythm. In other words, once they get fixed into a sleep pattern, it's actually harder for them to break that cycle. Much like when you go overseas, say to Europe, and you land in a different environment, some of your friends might be able to adjust really quickly, whereas you might find it a bit harder to adapt to that new environment, or vice versa. So some people in shift work, for example, tend to be able to adapt quicker. So if you're finding that you're one of those people that is having a hard time sort of managing that transition, it might be worth speaking to someone about potentially coming up with some strategies such as light timing and melatonin to help you adjust.
Those are some wonderful ideas. Thank you. The next question from David's mother is, if we don't remember dreams, are we still in REM stage of sleep? Earlier when you talked about if you wake up during REM, you'll remember your dreams. What about?
Yeah. Yes, you typically will have, I mean, pretty much most people experience REM sleep. REM sleep tends to cluster in the early stages of the morning, so before you wake. So if you're waking up really early, you might be missing out on some REM sleep, but generally if you're getting a full kind of overnight sleep cycle, you will experience some REM sleep. I mean, not everyone does remember their dreams. I guess the point, maybe I didn't articulate it very clearly, was that if you wake up out of REM sleep, you're probably not very likely to remember your dreams at all. But if you do wake up during REM sleep, you are more likely to remember your dreams. But when I say remember them, it even could be just for a few moments, like you have an awareness of the fact that you were dreaming. But then you quickly shift your attention to, oh, I've got to get up, I have to get the kids ready, or I have to go make a coffee or whatever it is, and then by that time you've forgotten whatever the dream was, because it's not something that you're consciously encoding into your memory. You're just more holding it in your short-term memory. So I hope that answers your question. But yeah, I think that you probably will still be getting REM sleep even if you can't remember your dreams.
Okay, great, thanks. The next question is from an anonymous attendee, and they've asked if people taking antidepressant medications are more prone to being affected by dementia.
We don't have evidence on that. We know that depression can increase the risk of getting dementia. And depression is sort of treatable with medication. So medications might actually help. So if you have depression or experience depression and you're getting it managed either with behavioral therapy or medications or a combination, that might be a good thing, especially if it makes you feel better. It might actually help to lower your risk of dementia. We do know that depression itself does or appears to have an increased risk of getting dementia. We also know that medication for depressions can impact sleep a lot. So antidepressants, for example, can change the architecture of what your sleep looks like.
Okay. Yeah, complicated process, I guess, but important to get those treatments and speak to your doctor about it. The next question is from Michelle. And she has shared that she has a close friend who suffered a stroke today. I'm really sorry to hear that, Michelle. But they'd recently discussed how we often wake in the morning due to very vivid dreams and a heavy tiredness. Do you know if there's any link between changed sleep patterns that could indicate a precursor to a medical condition like a stroke or yeah, like some kind of cerebrovascular disease?
I'm not aware of anything like, well, firstly, sorry to hear about your friend, Michelle. That sounds terrible. I'm not aware of any relationship between sort of dreams and dream intensity and sort of medical events. I guess it's possible if someone's feeling unwell, they might almost have this subconscious kind of recognition of something going wrong or and sort of have changes in their sort of mood and their sleep. So I guess I don't really have much to add that would be sort of obvious there, unfortunately. Not really my area of expertise, but yeah, I'm sorry to hear about the tragic event that happened today.
Yeah. I hope she recovers well, Michelle. The next question is from Leanne, and she's asked, in countries where they have months of complete darkness or complete light, do they have higher rates of dementia there?
Yes, again, a really good question. Not to my knowledge, they don't know. That is a fascinating thing, and it's not something that I've studied. Um, Obviously, when it's light for long periods of time, people are still sleeping. As to the quality of their sleep and the intensity of their sleep, I'm not really too sure about. But it is interesting how sort of people have adapted to that environment and sort of function in that environment, which is very different. I guess when we look at sleep and talk about sleep, we really do talk about it through a cultural lens. So, for example, my family originated from Italy. It's very common to have siestas, and my family back home still have siestas. And so, for them, having naps, for example, in the afternoon is completely normal and completely a part of life. Whereas for us here in Australia, that would be less of the norm. And so, I guess when I did talk about sleep today, I was really talking through I guess a certain cultural lens that might not apply everywhere around the world. Yeah. That's a great question. No, sorry, I don't have a better answer for you.
Mm. Yeah, no, well, it's a really interesting thing to learn. I guess there's so much variation across the world in risk. The next question is from an anonymous attendee, and they've asked if it's okay to take magnesium and valerian supplement to aid with poor sleep. Are they okay to take on a regular basis?
Again, I will just say that I'm not a medical doctor, so I won't prescribe any kinds of medications. But I do know of people taking magnesium. Obviously, if you make sure you're taking a dose that's safe and that's okay with your doctor, but it can sort of I've heard it sort of works to relax your muscles, and so some people do find it beneficial to get better sleep. The other one you mentioned, I'm not really familiar with, but if it's you feel like, I mean, one thing to think of is, if something is working for you and it's not associated with any sort of adverse effects, then I guess there's sort of no harm in continuing that routine. One thing that tends to work with sleep is having a regular routine. And I talked about having a regular routine in terms of maintaining regular sleep-wake schedules, but also having a routine before bed can also be good. So, if you feel like having a cup of tea or listening to music or watching a certain program helps you kind of, or taking something helps you sort of get in that mood for sleep, and it works for you, then I guess that's great, and you're probably advised to continue.
Okay, that's great. Thank you. I just realized the time, so let's try and get through a few more questions before 8 p.m. Uh, the next question is from Janice, and this is, I guess, similar to what we were talking about before with interaction between sleep and sleeping tablets, with cognition and dementia. Yeah, is there a relationship there? I know we covered this bit, sorry.
Yeah, no, that's fine. Again, a good question. One of the difficulties in studying this, and it's similar to some of the other questions that were asked, like, for example, the question on naps and is naps okay or is it good? It's hard to disentangle why someone is doing something in the first place. So, for example, is taking. Sorry, what was the question? It was about something in particular, Anik.
With like the relationship between sleep and taking sleeping pa tablets.
Sleeping pills, right? Yeah. So exactly, yeah. So when you study sleep, like the relationship between sleeping tablets and an outcome, it's not clear why someone is taking the sleeping tablets in the first place. And then you have what's called this, we call it, sorry about the jargon, but like bias of indication. So, some people will be taking a medication because they have something wrong with them. And that thing that's causing them to take the tablet is actually causing the high risk of dementia, not necessarily the treatment that they're taking. So we don't really know what the relationship is between sleep medications and dementia because it's really hard to disentangle. Is it sleeping problems that are bad or is it the treatments? But I guess it would be important to work with your doctor to work out if you're taking sleep medications regularly, whether that's something that's necessary or whether there's more behavioral things that you can do to sort of come off them so you don't have to take them long term, just in case there is sort of a risk associated with taking them long term. But
Mm.
yeah, in short, we don't have a lot of evidence.
Okay, great. Thank you for that answer. The next question is from Helen, and she's asked, "What is your advice in the management of cortisol levels and sleep?" So I guess how does stress affect it?
Yeah, so stress is obviously really important in the sense that you want to sort of manage it and reduce it as much as possible. Having high levels of stress is not pleasant, and it's also there are some links between high levels of chronic stress and actually changes that can take place in the brain and potentially a high risk of dementia as well. When I say high risk of dementia, I'm talking about very sort of small increases or small differences. But yeah, if there are specific stress management techniques that work for you, then that's great. Things like meditation, listening to music, taking time to unwind and relax. I mentioned before, for example, not using your laptop on your bed to do work or to do planning or to do tasks that might create feelings of stress or might create feelings of anxiety because that could disrupt your sleep. So doing things to reduce your stress more generally in your life. I know it's really challenging and we all suffer from stresses that sometimes are outside of our control. But to the extent that they can be managed, I think that would be wonderful for sleep, mental health more generally.
Mm, yeah, wonderful. Thank you for that. The next question is from Monica, and she was wondering if there is research around like, trauma or complex trauma, PTSD, and sleep, and if that, yeah, interacts with sleep and brain health.
Yeah, good question. Again, something that's a bit out of my expertise. So, I come at this very much as a dementia researcher first and foremost. And so, actually, like a lot of my research is actually on vascular risk factors for dementia, and sleep is just sort of one component of what I study. So, I know a lot more. I come at it from a dementia angle rather than a sleep angle. So, I'm not too sure about links between other conditions necessarily and sleep, but I do believe there are relationships between trauma and sleep. And yeah, again, I don't know what specific treatments would be, but I guess it's worth speaking to a sleep doctor based on your specific circumstances. Yeah.
Yeah. No, that's very fair. Thank you for that. I guess it's 8 p.m., so we should probably wrap things up now and let you get on with your evening. But thank you so much for a fantastic presentation and such a wonderful Q&A. Thank you everyone for being here tonight and being here throughout this week. I hope to see you for our last webinar tomorrow night, which is on, it's a Q&A session with an expert on migraine. So the whole time will just be dedicated towards answering your questions about migraine. Thank you so much, everyone. Good night.
Thank you.